The AI Revolution in Nursing. This presentation uses both real research findings and clearly labeled hypothetical scenarios. Here's a question that should keep every nurse awake at night. What happens when a machine knows your patient better than you do? At UC San Diego Health, researchers found that their AI system called Composer reduced sepsis mortality by 1.9% when implemented in 2 emergency departments, according to a study published in NPJ Digital Medicine in 2024. The system monitored over 150 patient variables continuously and alerted nurses when sepsis risk increased. But here's what should give us pause. At the same time, a University of Michigan study published in the New England Journal of Medicine AI in 2025 found that Epic's widely used sepsis prediction tool was only 62% accurate when using data recorded before patients met clinical criteria for sepsis. In other words, it often detected sepsis after clinicians were already suspicious, therefore not providing true early warnings. Meanwhile, companies like AgileMD are developing FDA-approved AI systems for broader clinical deterioration prediction, not just sepsis. Their eCart system received FDA 510K clearance in June 2024 and represents a new generation of AI tools designed specifically for nursing workflows. This is the story of how artificial intelligence isn't just changing nursing, it's rewriting the very DNA of healthcare. According to Mr. Seth Godin, the story we tell ourselves about that change is what determines whether we lead the revolution or get left behind. Before we dive into this complex world, let's acknowledge something uncomfortable. When most people hear AI in healthcare, they picture one of 2 extremes: either robots replacing nurses entirely or some magical technology that solves everything overnight. According to Mr. Godin, real change happens in the messy middle. It happens when real people with real concerns start asking better questions. Here is what makes this discussion complicated. We're not just talking about adopting new technology. We're talking about fundamentally redefining what it means to be a nurse in a profession with approximately 200 years of history. The question isn't whether AI will change nursing, but who gets to decide how it changes nursing. For those not aware, AI is already making clinical decisions in your hospital. AI in healthcare is not new. The concept of artificial intelligence was first described in 1950 by Al Turing and was coined artificial intelligence in 1956 at the Dartmouth Conference. Healthcare applications can be traced back to the 1960s and 1970s, with early systems like MySyn, which helped to diagnose bacterial infections. However, the real breakthrough came in the early 2000s with advances in deep learning, according to research published in Gastrointestinal Endoscopy in 2020. So, we've had over 70 years to figure this out. The question is, have we? Dr. Eric Topol, author of Deep Medicine 2019 and a leading digital medicine researcher at Scripps, has argued in his book and related writings that AI could democratize medical expertise, potentially giving a new graduate nurse in rural Montana access to diagnostic capabilities similar to specialists at major medical centers. In contrast, Dr. Sherry Turkle's decades of research at MIT on technology and society, including her book Alone Together 2011, along with subsequent academic work, raises concerns about what she terms our tendency toward technological solutionism, the belief that complex human problems can be solved with algorithms. Her research questions whether we're using AI to enhance human judgment or replace it. Think about this. If an AI system can predict patient deterioration more accurately than a human nurse, do we have a moral obligation to follow its recommendations, even when our clinical judgment disagrees? Think about that, because in 5 years or sooner, A nurse somewhere in this country might be in a courtroom explaining why he or she ignored an AI recommendation that could have saved a life. Or you might be explaining why you followed an AI recommendation that harmed a patient because the algorithm didn't account for something only human experience could recognize. Let's imagine the future. Here is the scenario. Let's call this the augmented nurse. In this future, AI amplifies human capabilities. I will give the nurse the name of Jennifer. Nurse Jennifer walks into patient's room 312. Her smart glasses immediately display the patient's risk scores, medication interactions, and discharge planning progress. But here's the key. She's still making the clinical judgments. The AI is just providing information faster than any human could process. When she touches the patient's arm and notices it feels different from what she expected, she asks the AI to analyze skin temperature patterns. The combination of her tactile assessment and AI data analysis reveals early compartment syndrome. In this future, nurses become clinical detectives with superhuman analytical support. However, critics argue that this future creates a two-tier nursing system. Nurses with access to advanced AI become super nurses, while those without become second-class practitioners. Is this the future that we want for nurses? Let's look at another scenario and call this one the AI-dependent nurse. In this future, the nurses become high-skilled technicians executing AI-generated care plans. The AI analyzes patient data continuously and generates specific interventions. Nurses implement these interventions with precision, but the clinical reasoning comes from the machine. Some believe this reduces medical errors and standardizes care. In this future, every patient receives evidence-based interventions. But ask yourself, if nurses aren't developing clinical reasoning skills, what happens when the AI system fails? What happens to critical thinking? What happens to the art of nursing? Dr. Patricia Brenner's foundational research, particularly her 1984 book, From Novice to Expert, and subsequent studies show that nursing expertise develops through experiences and reflection. If we remove the reasoning component, are we creating a generation of nurses who can't function without algorithmic guidance? Here is scenario number 3. I will call this one the human-centered nurse. In this future, AI handles routine tasks, freeing nurses to focus on complex human interactions. The AI monitors vitals, predicts medication needs, and manages routine documentation. Nurses spend their time on therapeutic communication, family support, and complex clinical reasoning that requires human judgment. This sounds ideal, but it raises uncomfortable questions. How do we determine what's routine? Who decides what nursing functions can be automated? And what happens to nursing jobs when AI can handle 60% of current nursing tasks? Let's consider an ethical dilemma that has to do with bias. Did you know that AI systems inherit the biases of their training data? There was a landmark study published in October 2019 by Dr. Ziad Obermeyer. The study revealed that a healthcare algorithm used by hospitals serving over 200 million Americans systematically discriminated against Black patients. The AI recommended Black patients for high-risk care programs only when they were significantly sicker than white patients. The algorithm wasn't intentionally racist. It was designed to predict healthcare costs, not health needs. However, because Black patients historically receive less expensive care due to systemic barriers, the AI learned that lower costs equal better health for Black patients. The result, a seemingly neutral algorithm, perpetuated healthcare disparities on a massive scale. So, here's your dilemma. You're caring for a Black patient with chest pain. The AI recommends discharge with outpatient follow-up. Your clinical judgment says this patient needs admission. Do you trust the algorithm and proceed with the discharge, or do you speak up and advocate for the admission of the patient based on your clinical assessment and clinical expertise? And here's the uncomfortable truth. If you consistently override AI recommendations for certain patient populations, the system might flag you for non-compliance with evidence-based protocols. This is a real possibility and something to think long and hard about because AI is here to stay. Here is another ethical dilemma. I will call this one the responsibility gap. Similar to the discharge issue of the black patient based on a programming glitch with AI, who is responsible when AI makes a mistake? Here's a hypothetical scenario. An AI system in an ICU recommends reducing blood pressure medication for a patient. The nurse follows the recommendation and the patient suffers a stroke. Who's responsible? The hospital blames the nurse for not using independent judgment. The AI company blames the hospital for not properly training nursing staff, and the nurse could face potential disciplinary action. But here is a twist in this scenario. Later analysis shows the AI recommendation was actually correct, based on the latest diagnostic evidence. The stroke was a rare, unpreventable complication. So who is really responsible? How do we assign accountability in a system where humans and machines share decision-making? Here is a question. Does AI enhance nursing autonomy or diminish it? On one hand, AI could give nurses access to advanced diagnostic capabilities traditionally reserved for physicians. A nurse with AI support might catch a major life-threatening condition that might otherwise require a doctor's assessment. On the other hand, if AI systems are making clinical recommendations, are nurses becoming implementers rather than independent practitioners? Dr. Margaret Sandalowski, a prominent nursing researcher, argues that nursing has always been about intelligent action in uncertain situations. If AI reduces uncertainty, does it also reduce the need for nursing intelligence? So, what will be the ultimate result? Are we revolutionizing nursing through an AI partnership? Or are we systematically dumbing down the profession? Some could argue that nursing programs have already started the dumbing down process with no influence from AI. There was a time in nursing when we had very little voice and were not viewed as an independent profession with our own body of knowledge and clinical judgment. We have moved past that and now collaborate as equals in patient care. Are we about to trade one form of professional subordination for another? Instead of being told what to do by physicians, are we creating a future where nurses are told what to do by algorithms? This isn't just philosophical. It has real legal and professional implications. Let's take this a step further. How do we handle AI-human disagreements when a nurse's clinical judgment conflicts with AI recommendations and the nurse is wrong? Does this become a learning opportunity where we explore why AI caught something human assessment missed and help the nurse develop more sophisticated clinical reasoning? Or discipline the nurse, effectively teaching the nurse to stop thinking independently? I believe many would say the latter would prevail, and that should alarm everyone who cares about the future of nursing. Can AI be a good thing? AI has the potential to give nurses access to diagnostic and predictive capabilities that could elevate the profession to new heights. However, the same technology could reduce nurses to high-skilled technicians who implement AI-generated care plans without developing their own clinical reasoning abilities. One can argue that it really isn't about the technology, it's about how we choose to integrate it. There are some reports that in Denmark and Sweden, AI has been implemented and is nurse-led. Nurses are designing the algorithms, defining the parameters, and controlling the implementation. They're treating AI as a nursing tool, not a replacement for nursing judgment. What an incredible time for nurses who enjoy technology to consider nursing informatics, an area of nursing where nurses have a major role in AI design and integration. Nurses who train in this area understand both the clinical workflows and technology, making them essential bridges between the human and digital aspects of care. Not only does this have the potential for better patient outcomes, it could also lead to higher job satisfaction. But critics argue this approach is too slow and conservative. For those who are not aware, Countries with severe nursing shortages see AI as a necessity, not a luxury. In places like rural India, AI-powered diagnostic tools allow one nurse to manage patient loads that would require 5 nurses in the US. In these countries, AI appears to fall under innovation, but some could argue that it is exploitation. It is hard to say without more information. If you had to choose between AI-assisted care and no care at all, which would you choose? The skills that make nursing valuable are changing rapidly. Technical skills that took years to master might become automated overnight. Skills like clinical reasoning, ethical decision-making, and therapeutic communication become more valuable, not less. Things such as routine monitoring, basic documentation, and simple assessments in many places are already automated. As mentioned, this area is a goldmine for nurse informatics. In addition, new roles are emerging, such as AI nursing specialists and algorithm auditors. Are the nursing programs ready for this? Here are some controversial opinions. Nurses who resist AI will become irrelevant. But nurses who embrace AI without critical thinking will become dangerous. The future belongs to nurses who can dance with AI, partner with AI, question AI, know when to trust AI, and when to override AI. The future of nursing isn't something that's happening to us. It's something we're creating with every choice we make about how to integrate AI into our practice. Seth Godin asserts that remarkable things happen when we stop asking, "How do I avoid change?" and start asking, "How do I lead change?" The conversations we have today about AI in nursing will determine whether nurses lead this transformation or get swept along by it. What side of the conversation will you be on? Please visit RedoLifeJ74.com to download the interactive Nursing Challenge questions. It is a good way to practice for a test and also to test your knowledge. If you are in school, the key is to read, reread, and then read some more. It is a lot, but you can do it. Please like, share, and subscribe.